Hello, and welcome to our third module for matrix documentation training. In this module, you will learn about our matrix flowchart from referral to enrollment and beyond. It will take you through the required documentation in the referral process, the enrollment process, and after enrollment as clients work through the matrix program. Let's get started. Next slide. Patients should be told at induction that continued illicit use of substances may result in a referral to the matrix program. They could be referred to another intensive outpatient level of care or another higher level of care in the community, depending upon assessment results. At 90 days from clinic enrollment, if UDS are consecutively positive, the OTP counselor is going to advise the patient that they will be initiating a referral to a higher level of care, either the matrix program or another higher level of care with a different provider. It is important to communicate to patients upon admission that reduction or elimination of illicit substance use will be the priority focus in the first 90 days. Next slide. The OTP counselor will write up an in-house referral for the client to be assessed for matrix model services. The referral should include documentation about the client's continued substance use, including what substances they're using and their UDS results. They should also indicate if the client has voiced a desire to reduce or eliminate their harmful substance use, whether they have a support system in place of family members and/or friends who are willing to participate in treatment activities with the client. If the client chooses not to engage in matrix, a different referral to an appropriate treatment program in the community will be made. If they refuse to follow through with the referral or recommendation, they may be placed on a 21-day taper. All referrals are documented in the client record. Next slide. The OTP counselor will determine if there is a need for a referral for medical or inpatient withdrawal, for medical treatment, or whether the client has significant legal obligations. If a client has significant needs in any of these areas, enrollment in the matrix program may be deferred. The OTP counselor will work with the client to seek out and receive needed care and/or services. They will also determine if the client needs a thorough mental health assessment. If it is determined that a higher or more intensive level of mental health care is indicated, the OTP counselor will work with the client to access the needed mental health services. The OTP counselor will discuss the client's support system with them to determine who can participate with them in the matrix program. The OTP counselor also reviews the current brief addiction monitor, or BAM, and the ASAM assessment with the client. Next slide. The team conference includes the OTP counselor and the counselor providing matrix services. Together, they will discuss the referral and assessment results to determine if the client would be best served by attending the matrix program. Next slide. During enrollment, before the client starts to attend the groups, the matrix counselor will use the Adverse Childhood Event Survey, or ACEs, to assess and document the client's childhood trauma. This score is noted in the matrix DAP note for the matrix orientation in method 1. If the client score is a 4 or higher on the ACEs, the matrix counselor will have them complete the Devereaux Adult Resiliency Survey, or DARS, and incorporate the strengths, goals, and strategies section of the survey into the resilience section of the client's recovery action plan. The matrix counselor will also use the stages of change model to assess and document the client's readiness for change. They will complete a session note and indicate if client participation in the matrix program will be supported by a referral, parole, probation, therapist, etc. Finally, they will assist the client in developing a recovery action plan addressing the findings from the above-mentioned assessments, in addition to the client's identified goals for recovery. The recovery action plan is not a treatment plan. The client will keep the recovery action plan in their matrix folder or notebook. Next slide. At this time, the client receives a matrix orientation packet. They also receive, review, and sign a matrix participation agreement. They will work with the counselor providing matrix services to develop an individualized recovery action plan. This plan is not a treatment plan. They will also receive a schedule that indicates when they will start attending groups for the matrix program. Next slide. A client's attendance in the matrix program is not time limited. Rather, they move through the various stages of treatment based on their desire and capacity to engage in positive behavior change. It is not uncommon for clients to find that they need to return to the early recovery skills or relapse prevention components of the program if they experience a return to use. The early recovery skills component of the matrix model is offered twice a week over a 4-week period. Clients enroll at the beginning of treatment, complete a 4-week cycle, and repeat the 4-week cycle as often as needed, so long as the client is demonstrating progress in treatment. 2 early recovery skills group notes should be found in the client's chart for each week they attend early recovery skills groups. Missed groups are also documented in the chart. Next slide. The relapse prevention component of the matrix model is offered twice a week over a 16-week period. Clients enrolled at the beginning of treatment complete a 16-week cycle and repeat the 16-week cycle as often as needed, so long as the client is demonstrating progress in treatment. 2 relapse prevention group notes should be found in the client's chart for each week they attend relapse prevention groups. Missed groups are also documented in the chart. The family education component of the matrix model is offered once a week over a 13-week period. Clients enrolled at the beginning of treatment and complete a 13-week cycle. Family participation is strongly encouraged. Family is interpreted broadly to include anyone who the client has a significant relationship with and is supportive of their efforts to seek and maintain recovery. 1 family education group note should be found in the client's chart for each week they attend family group education. Missed groups are also documented in the chart. The social support component of the matrix model is offered once a week once clients have completed the family education component of the matrix model. It is offered at a minimum of 23 weeks. However, matrix clients may continue to attend these groups if they find them helpful. 1 social support group note should be found in the client's chart for each week they attend social support groups. Community support meetings are offered once a week and are open to all matrix clients. Clients in the first 16 weeks of the matrix model program are required to attend at least 4 community support meetings. 1 community support group note should be found in the client's chart for each week they attend community support groups. In the first 16 weeks, missed community support groups are also documented in the chart. If a client has not attended at least 4 community support groups within the first 16 weeks of their attendance in the matrix program, they will remain enrolled in the relapse prevention component of the matrix model until they have attended 4 community support meetings. Next slide. While a client attends relapse prevention groups, so for at least 16 weeks, they will provide a random UDS each week and attend a 60-minute one-on-one counseling session with their matrix counselor once a week. Once a client has completed attending relapse prevention groups and attended at least 4 community support group meetings, they will be qualified to step down and provide a random UDS once a month and receive a 60-minute one-on-one counseling session with their matrix counselor once a month for at least 23 weeks. All one-on-one counseling sessions with the matrix counselor will be documented in the client chart. All UDS results will also be documented in the client's chart. Recovery action plans are developed with the client upon admission and reviewed monthly. The recovery action plan is also reviewed upon completion of the relapse prevention component of the program and at any time the client and/or counselor believes that a review is warranted. Next slide. 2 early recovery skill group notes should be found in the client's chart for each week they attend early recovery skills group. Missed groups are also documented in the chart. 2 relapse prevention group notes should be found in the client's chart for each week they attend relapse prevention group. Missed groups are also documented in the chart. 1 family education group note should be found in the client's chart for each week they attend family education group. Missed groups are also documented in the chart. 1 social support group note should be found in the client's chart for each week they attend social support groups. 1 community support group note should be found in the client's chart for each week they attend community support groups. In the first 16 weeks, missed community support groups are also documented in the client's chart. All one-on-one counseling sessions with the matrix counselor will be documented in the client's chart. Once a week until they step down, then once a month until they complete. All matrix UDS results will also be documented in the client's chart. Once a week until they step down, then once a month. Recovery action plans are developed with the client upon admission. Recovery action plans are reviewed monthly. Recovery action plans are reviewed upon completion of the relapse prevention component of the program. Recovery action plans are also reviewed anytime the client and/or counselor believes that a review is warranted. You have reached the end of this video. Please be sure to take the quiz in this module and review the matrix documentation handout provided.